As the circuit breaker comes to an end, workplaces will reopen, parents will need childcare support, and younger children will need to continue with their learning and development. To support parents who would like care arrangements for their children, preschools as well as early intervention centres will start to resume general services from the 2nd of June 2020. They will reopen in phases with an emphasis on safety and minimizing the risk of transmission. So this is the phasing. Our preschools, the children can return by cohorts. On 2nd June, K1 and K2 children can return. A week later, on the 8th of June, Nursery 1 and Nursery 2 children can return. And from the 10th of June, infant care and playgroup children can return. So that is for preschool. Now let me start with COVID Safe A, access. Some of our key precautionary measures include restricting entry of visitors, as well as people who face a higher risk of infection. These would include those who are family members, those whose family members are on stay-home notice or home quarantine. We would ensure that there's strict temperature and health checks for all staff and children multiple times a day. And this is not just a requirement that we impose, but these have to be carried out as a process frequently throughout the day. So it has to be carried out as a process. Those who are unwell will not be allowed to enter the center and they should see a doctor immediately. COVID-safe behavior is about instilling culture, habits, practices, and norms among preschool staff, among the preschool children, as well as parents of preschoolers, all having to instill that culture in order to reduce the risk of transmission. So frequent hand washing, taking care of each other. In addition, children aged 2 or older will have to wear a mask or a shield when in the center. In fact, during the circuit breaker period with limited service, that means for children of healthcare workers or essential service workers who are not able to work from home, already the children in the preschools today have been wearing masks. They are above age 2 and above. And so far, most of the children have been able to adapt to wearing those masks. Now, the third phase of the ABC is C, classrooms, COVID-safe classrooms. And we want to aim to reduce physical interaction and cross-contamination between different classes and cohorts of children as much as possible, even though you know that in a preschool setting, a space is always, either void deck or a center, and they will need to do some reconfiguration. And so what we'll do will be to stagger drop-off and pick-up times to allow for safe distancing as parents bring the children to the preschool. We will stagger the use of common areas and facilities so that different classes use the spaces at different times and they're cleaned in between. There will be suspension of activities that involve more than one class or cohort. And of course, safe classrooms also depend on safe staff interactions between teachers and among teachers. So staff meetings should be conducted virtually as far as possible, but if they need to do so, apart from using video conferencing technology, they should exercise safe distancing measures. We ask that our preschool community of staff and children and parents not see this merely as rules and regulations. These measures are essential to safeguard the health and well-being of all within the centres, and adherence is absolute necessity. So everyone has a part to play, staff, children, as well as parents, and we must cultivate these safe habits such that they become second nature to all of us. And only then can we ensure that the measures are as effective as can be.